Do recent findings regarding the use of dually active antiretroviral therapy suggest particular treatment recommendations for HIV-infected patients who are also at high risk for hepatitis B infection?
So this study that was reported recently at the Conference for Retroviruses and Opportunistic Infections demonstrated that individuals who didn't have any markers of hepatitis B at enrollment in a cohort and later examined those individuals after observation, the ones that were taking hepatitis B active antiretroviral therapy had a lower likelihood of developing seroconversion to hepatitis B than other individuals who were on other types of antiretroviral drugs or not on any antiretroviral drugs at all. And that was really the first time we had any evidence that by taking a medication that was active against hepatitis B, you might be able to prevent hepatitis B infection, similar to what's been shown for HIV, where taking tenofovir, for example, reduces the incidence of HIV infection, so-called pre-exposure prophylaxis with medicines. With hepatitis B, the reason why that's not been at the forefront is because we have a vaccine that's so effective and so safe for prevention of new hepatitis B infections. But HIV-infected individuals have a lower response to hepatitis B vaccine, and so up to a third, in some cases even more than half, of HIV-infected persons, especially those that had advanced HIV, low CD4 counts, don't respond to the hepatitis B vaccine, and we think that they're not protected against getting infection. So the question, do these data provide a new pathway, a new way to protect those individuals who don't respond to the hepatitis B vaccine? And I think the answer is that it might, but we certainly need additional data to make a conclusive guideline in that regard, because there's factors other than whether or not they took hepatitis B active antiretroviral therapy that also could have brought about that same result. But nonetheless, in selected cases now with individuals who are at high risk for hepatitis B and whom you can't achieve seroprotection with vaccine and or behavioral control, that would certainly be an interesting and innovative approach.